Okay, as I mentioned, we'll press on with the presentations, and then we'll see how much time that we have for hopefully some questions. Many thanks, Mike, for that excellent presentation. I would now like to invite Michele, who's on her way up here, Michele Hardiman, who is Assistant Director of Nursing Practice Development Education Research Facilitator at the Galway Clinic. When you listen to her, you'll hear her passion about person-centred practice. She has just submitted her PhD on facilitation of person-centred cultures. One of the outcomes emerging from her work is the development of person-centred nursing documentation for the Galway Clinic, which she will outline just now. So thank you, Michele.
Good afternoon. When I was asked only the other day to come here and describe some innovation from the Galway Clinic, it was very difficult to actually choose one, because there is kind of quite a lot going on. Some of you may be aware that we have recently kind of gone live with our brand new electronic documentation. We've locally named it eCurum, which is Meditech 6.1, and we're the first in Europe to be able to have that go live successfully on the 1st of May. I suppose as part of that, this is the oak I use, is it? As part of that, we started building this 2 years ago, so the preparation was quite early on. We have other things, so the benefits of the electronic record from a nursing perspective is something that we are aware of over the last 10 years in the Galway Clinic, because it's been there for 14 years since the hospital opened. But when we got the opportunity to look at the gaps that we had in capturing the unique contribution of nursing within the electronic record, we looked at what we were being offered from the vendor, from Meditech, and decided actually that it didn't really meet the requirements and standards that we needed to meet here. So there is the benefits for the EMR to nursing is that you have complete record assessments, care plans based on preset evidence-based content. So it's very clear, the benefits, and some of the speakers this morning were talking about the benefits of e-health and or electronic records for the maintenance or good maintenance of patient information. And from a nursing perspective, we know that it captures who, when, how in real time. It's seamless with limited exceptions. Because some of the systems, very limited amount now, don't talk to each other, but other than that, we have a seamless, so that it carries through from registration right out to discharge and discharge letters, and everything else in between, including financing, billing, etc., diagnostics and all the rest. But I suppose and we have instant access to results, orders, prescriptions. It's intelligent and it stimulates other activity, for example, pharmacy, radiography, labs, etc. And it never gets lost. I spent many years in the HSE searching for charts. So it never gets lost, and it's always available to encourage patient records. But one of the debates that's going on in Irish nursing at the moment is around the e-health and moving towards electronic patient records, is how we capture the unique relationship between the Irish nurse and the patient, which is slightly different from the American model. So, and this is one paper that was written as part of the e-health strategy, is if and how nursing advocacy and compassion can be articulated in computing terms. So we took the opportunity, as we were looking at the new electronic record and building our new system, we took the opportunity to build into it the person-centred framework which we have adopted in our nursing units in the Galway Clinic. And the person-centred practice framework, and you will be able to kind of see that the practice framework actually covers, it's McCormick McCants, and it was originally done as a nursing model, but it's now been used worldwide as a quality improvement model to look at the way that we deliver person-centred care as different from patient-centred care. I would always kind of say our colleagues from JCI, which I believe that the JCI standards are ultimately person-centred, not patient-centred, because they incorporate all of the elements that involve the families, the staff, the care of the patient chapter, the PFR chapter, all of those, and all of the ways that we work together as well as with patients and their families is important that we have a system. And the person-centred framework covers all of those systems and processes as well as the person-centred outcomes that we would be more familiar with for patients. So we sat down and as a team actually looked at the Generation 2 nursing documentation, and what we wanted was to provide a comprehensive holistic record of assessment, planning care, interventions, and the evaluation of that care delivered. We needed and absolutely had to have the documentation that meets the legal and professional requirements of the Nurses Act, the NMBI, and the JCI hospital standards where we were living up to. We also wanted, because there's a big drive here in Irish nursing, to look at and incorporating international nursing language so that it could be mapped onto a SNOMED, which was the international method of being able to look at diagnosis. But we also wanted to provide evidence of person-centred nursing practice and to fit in with our other nursing philosophies that's now been incorporated into the rest of allied health professionals and other processes in the Galway Clinic. So, and we included the use of person-centred language in preset content that will in turn support person-centred practice. And this is what we're now kind of bringing to life as we've gone live. And the key thing is that it encourages nurses who work very much by the bedside, so it is documentation in real time. Every nurse on duty has a cart to record and involve with the patient. They're involved in their care processes. So it's not about informing the patient of their care, it's involving the patient in their care in a very real and meaningful way. We have a new byline in the Galway Clinic that is what matters is you, and we're trying to bring that to life within our relationship with the patients. So it's who matters to you, what matters to you, what do you like to be called? A very simple thing. There was a big campaign in the NHS about that. How can I help you? Are you anxious? The things that we don't always focus on or, more importantly, record in our nursing records. So I have no doubt that nurses throughout the country are asking these questions, but it's very rarely reflective back when you read back in the record of the care that's been delivered. So we have what we now want is we want to achieve person-centred outcomes, which is going back to McCormick McCants, which are good care experience, the involvement in care, feeling of well-being, and the existence of a healthful culture, which incorporates our therapeutic culture and how we work together. And there are tools and mixed research methods that we can use to measure those and how effective that we are at doing that. And certainly our new record is now giving us some of those tools that we will be able to pull from the record to be able to measure the person-centred outcomes to go along with the other outcomes that we measure, like clinical outcomes and the PROMs or the patient-reported outcome measures. But we now are measuring person-centred outcomes to meet and improve the experience of care in the Galway Clinic. And this is our research question that we are putting forward that we're hoping to start later on this year. We have some preliminary baseline work already started, is can the development and introduction of person-centred documentation within the electronic patient record result in improved quality outcomes and a positive experience of care? So it'll be interesting to see what the outcomes from that research will be. And that's all from the